And finally on the Factor Uncensored tonight, whooping cough making a comeback with kids. The important information you need to know now. And joining us on the Factor Uncensored tonight, we have with us Dr. Danish Ali from Archpoint Pain Institute. Dr. Ali, we hear a lot of kids are coughing around America today as a result of whooping cough, which I hadn't heard of in quite some time, but now we're seeing or hearing that we're having an all-time high number of cases according to the Centers for Disease Control.
That's correct, Isaiah. We've seen a 4 times increase in the number of cases from just last year for folks who have been diagnosed with whooping cough. These are patients, and we see this increase, Isaiah, most recently because the amount of vaccinations for Tdap or the vaccines that kids normally get from their pediatricians had declined, and because of that, we've seen an increase in the number of cases of Bordetella pertussis, which is also whooping cough. And this is a very discreet coughing sound that these kids are making. It's often seen in folks that are younger than 2 years of age, and it's a very discreet sound of a cough. And oftentimes it can lead to pneumonia and bacterial infections. And so that's why it's so important for, number one, kids to get vaccinated. But number two, if your kid is coughing, don't just toss that up to the normal upper respiratory infection symptoms. Get that checked out because there is a very easy test, a nasal swab or an oral swab that can be done that can show if this is a bacterial infection. And if it is, it can be treated as such, and it resolves very fast if it's treated, detected early, and treated fast.
All right, Dr. Danish Ali, Archpoint Pain Institute, we appreciate your information and thank you for joining us here on The Factor tonight.